If you let yourself be in a caloric deficit day in and day out over enough period of time, when you hit a plateau, what you created was a temporary hypothyroid situation. I say metabolic downregulation, what your plan is. Also, one more thing is experimenting with trying to accomplish a workout that doesn't trigger it. That's another kind of path as well. Take the herbs, get the sunlight, identify the stress patterns in the afternoon, exercise in the morning if you can, and then improving your sleep quality. Those are like the things that you can start focusing on now. This protocol, the focus is lasting weight loss. The focus is improvements in metabolic health. But so many people with this protocol do achieve resolution of many issues just by nature of doing these things, which is pretty amazing. That's why I call it like a little bit of a mini sort of functional health approach, because we're getting down to the basics, right? We're getting down to the basics. We're improving micronutrient deficiencies. We're getting regular with our exercise. We're improving our nutritional approaches. We're optimizing sleep. We're optimizing stress. Those are the foundations for any functional approach. But if you do have some sort of random thing like an exposure to a certain toxic thing or a random food sensitivity or some sort of genetic thing, it's going to take a deeper dive from a functional expert. So I think it's a great topic for everybody to learn a lot from that. That's why I ran off with that, just understanding a lot about functional and how much more this is doing for all what we teach you guys, what this is doing for your health as well.
Yeah, weight loss wise, I'm fine. I've been doing that, doing the intermittent fasting, got some of my longer fasts up to about 42 hours. That's about as long as I've gotten.
Awesome.
For me is right now is just struggling to get the resistance training in. So I struggle with vertigo a little bit. I put that question out there. So that's the one thing when I exert, it kicks in.
Really?
So that's the one thing I'm trying to balance to try to figure out how I can get my resistance training in. So
Have the doctors said anything to you as to why that's happening?
no, they just say it just started happening a couple years ago and I just allergies and things, but they'll have me do the exercises to try to balance my crystals, but
Nothing seems to be working.
no, they just want to give me a medicine which makes me tired. Oh,
Yeah. So you're getting, when you start anything that gets your heart rate up, this triggers it, or anything that's like pressure, like internal pressure.
pressure. Yeah, it's more pressure, or if I bring my head below, like to pick weights up, those types of things, that's where I get out of balance and such. So that's literally my main struggle right now. It's just getting over that.
Do you have any leaky gut, any other inflammatory autoimmune things, any symptoms, anything like that?
No,
No food
everything
sense.
else has been pretty model, I guess you
Okay.
could say. I've been pretty lucky with everything.
Fantastic. No other food sensitivities, no other toxic exposures, nothing that you can think of that's unusual or weird.
Not that I'm aware of. Actually, since I've been on your program and clean eating, I've had better luck in that area with reducing a lot of processed foods. And I was a
Awesome.
snacker before, so that was always that was my biggest problem, was not quantity, but it was quality of food.
Right.
But yeah, that's probably mine. I'm worried that I'm going to start losing, or I probably have already started losing muscle tone.
Yeah, that's going to be a thing. That is going to be a thing. The chances of really accomplishing sustainable weight loss without resistance training is it's very hard. Could somebody potentially pull that off? Maybe, but I think it's really hard. And it's already hard enough with even if you do lift weights. So I would definitely prioritize. I'm sure you are already trying to figure out. And the reason I was asking those questions is I have seen some vertigo-like situations that were really random like that, unexplainable, and it ended up being like an autoimmune thing. How do what do you do, right? Their autoimmune disease is we it's not a bunch of different conditions, right? So autoimmune disease is the same issue that manifests as different presentations, but it's an issue where the immune system is targeting certain tissues for destruction, and it creates inflammation and it creates problems, and it can happen anywhere in the body. And I think the difference clinical presentations are a compilation of different genetic predispositions, different environmental factors, different toxic exposures, and all the above. So there are common recognized autoimmune diseases that the medical, even the allopathic Western medicine system will recognize because there's enough of them. And all that means, by the way, when they recognize it, an autoimmune disease, is that there was enough people presenting with the similar symptoms that they researched a drug. That's all that means. And I've seen so many people have weird, bizarre symptoms and they work with functional medicine and they get it fixed. And so I personally look at that as a result of just potentially an unknown autoimmune disease that's just not even recognized yet. So I think as you move forward in this journey of yours, if this is just not getting better, or even worse, it's getting worse, right? That would be a worse scenario, but not getting better, preventing you from lifting weights is a horrible thing right now because of the long term. So that might be the path that I would suggest you explore is more functional medicine. And our program, the FLOA protocol, is semi-functional, right? If you look at the stuff we're doing, it's very powerful in the functional, holistic space, very unique with the fasting, but everything else, you're going to get that from a functional specialist. But for example, if you do everything I teach you and this still can't get better, recommending you to a functional practitioner like the one I have, one that I recommend, I call the Wizard. But what he would do differently would be the step up, right? So like you have the foundations, but then he could do some really in-depth analysis via stool analysis, very deep comprehensive analysis, and try to identify, digging deep, what is going on and potentially find a solution for you. So it's expensive. Functional medicine is expensive. That's a deeper dive. You're spending thousands of dollars, but it's absolutely the path I would refer anybody to for any sort of condition that doesn't get better with this protocol. What your plan is. Also, one more thing is experimenting with trying to accomplish a workout that doesn't trigger it. That's another kind of path as well. Have you tried different types of workouts and maybe not bending your head when you go down, like different maneuvers with the body to see if you can work around that? Because maybe you find out your trigger is when you flex the neck. So don't flex your neck. I'm just hypothetically spitballing here, but I've seen that. I've seen certain people with vertigo triggered by a bend. And so they just have to learn their physical orientation triggers. And then once you learn them, you just avoid them and work around them. So I would try to give that a shot for sure. Now, keep in mind, you can induce a temporary hypothyroid, guys, when you create a weight loss plateau, because that's what a weight loss plateau is. If you let yourself be in a caloric deficit day in and day out over enough period of time, when you hit a plateau, what you created was a temporary hypothyroid situation, which is, you've heard me talk about it when I say metabolic downregulation. Now, your case is different because you've had the situation ongoing for a while, but for everybody else, you don't necessarily need to jump on thyroid med if that happens, nor should you, because your low thyroid will fix itself when you do the reverse diet that I've taught you guys. But yeah, in your case, there's other issues as to why you needed the thyroid support for however many years you've been on it. So I would definitely have us take it over.
When I first did the lab test, when I joined your group, they said my hormone levels were like 4.8. So they were I need to up my thyroid medication. Would you just suggest then upping my thyroid medication, or is there some other thing I should do?
You've been on thyroid medication for a while before us?
Yeah.
Yeah, so it's pretty common that people come to us and they're already medicated for thyroid, but they're not really being managed great because general allopathic management of thyroid is horrific. They look at TSH and that's it. And if we told you that your thyroid needed optimization and you've already been on thyroid, that's why. So we can take over your thyroid management if you'd like. It's actually just like the LDN. When you are a warrior, LDN management, thyroid management is covered. When the warrior coaching is over, you would have to resume finances for either of those programs. So if you're interested in that, just text the medical line and we can get you set up for that.
Okay.
That will make you need to do that. If we told you your thyroid is not optimized, you need to get in there and get it fixed, because nothing we can do can override a low thyroid.
And maybe that's why I'm plateauing.
Potentially.
So I've been doing the tirzepatide for the 0.5 for, I want to say, a good 3 weeks now. And it's just not curbing my appetite much. I don't know what's going on. And I was originally down 55 since I had started. Everything was going great. Like it was continuous. But this last week, I've just had a rough week and gained some back.
So let me make sure I got the full history. You've lost a total of 55 pounds, a lot of which you lost before you got here, right?
It was only about 20 before I got here. So I lost,
Perfect.
but it's been 35 since I've been with the tirzepatide.
Gotcha. And then you said, okay, so yeah, so some prior to GLP, you lost some weight, and then you were with us, and you've been on the 5 milligram dose for how long?
3 weeks.
3 weeks. Okay, so prior to that, you were doing great on 2.5.
Then I felt like it was fine.
Okay.
It did the same thing where it started like not working with the hunger. I wasn't noticing it as much.
Okay.
So
And then 5, then it was good, 3 weeks, and now this is your first week at 5 where you're feeling like the way 2.5 was before.
Yep.
So this is a great topic, right? Because this will happen to some people. So there's 2 ways to approach that sort of situation, right? Standard PCPs, obesity specialists are just going to say, let's go up again. Like that's all they're going to do, right? And that's one approach. Maybe you try that and it feels great, and maybe that slightly higher dose, maybe that works and you don't have the same thing happen again, or maybe it keeps happening. We don't know. And that's why I hate that approach because it just might keep happening, right?
Yeah.
So the real question we need to be asking is, why is it happening? Okay. Now, for some people, this is going to happen, and it's the result of too many factors to even consider. It's interesting though. It's one thing to say you start 2.5, you don't notice anything, you go to 5, you don't notice anything. It's when you never notice it, and then all of a sudden you get to a certain dose and then you notice it, it's okay, great. You needed that high of a dose to start. But in your case, it was working, but then you kept developing a resistance, right? So why are you developing this resistance several weeks into it? And again, we don't know. I can only speculate from when I see these kind of things happen. It's a reaction from your body that's there
just
because
to
of
tell you, with all my medications, my whole entire life has been like this. So
Okay.
to your point,
That's even more, then that makes a lot more sense, right? So that's an interesting scenario that I don't know if you'll ever find an answer as to why that's happening. That's interesting. I would argue there's probably some underlying inflammatory, some underlying medical things that we'd have to take a deep dive into that. But okay, so we know that's an issue, right? What do? We talked about the first path. The second path is, could you potentially, first of all, it's only been 1 week. So I would give it 2 weeks before you make any major decision. Let's just say the second week, same thing. This is where I would try, but you can, if you want the faster solution, 5 is still a moderately low rate. So I'm okay if you need to go to 75 units, 7.5 milligrams. That's still far from the maximum dose, which is 15. But if you want to be more conservative and put in a little bit of effort to see if we can accomplish, I would look at adding some appetite suppressing supplements. Are you taking any Unimate right now?
no, the Unimate I ordered, but I think I ordered it totally wrong because I got this coffee stuff that tasted like tar, and then I sent it back and
Is
didn't
it the
re-get
Unimate
it. So.
Black?
Yeah, it was
I
horrible.
actually love that one, but it's
No, oh God, that was horrible.
it's like an offish coffee. It was their attempt to make, that's the right product. It was just a coffee flavor.
Okay, so I just need to get the different flavor. Okay.
Yeah. Are you taking any curcumin or resveratrol?
I don't even know what that is.
Because I wonder how much potentially underlying inflammation, and I do wonder if
I have MS.
Multiple
Got
sclerosis.
lots of inflammation. Yep.
Yeah, and now it's starting to unravel a little bit. Are you taking LDN?
No.
Are you familiar with the low dose naltrexone at all?
Mm-mm.
I absolutely want you to check that out. As a warrior, you get free access to the management of it. I would strongly recommend you take LDN. Not only is that going to help your MS help it and help you feel better, but I wouldn't be surprised if that makes you more sensitive to the medication again, truthfully.
Okay.
So I'm thinking let's go down an inflammation path and lower your inflammation as much as you can. Curcumin and resveratrol, or turmeric and resveratrol, you can purchase those supplements from my Welcome To form. I would recommend that. I would recommend the LDN. And you can try that for a couple of weeks and see if that makes the 5 milligrams feel more responsive. Or you can just say, you know what, let's just, like I said, you can make your own decision and increase your own dose. But
It's inexpensive.
yeah, the curcumin resveratrol is going to cost money too.
Is it the
So
same? Okay.
you'd have to run the numbers, but that's better long-term for you, right? Because
Yeah.
then as I've taught all you guys, it's easier to wean off at the end, the lower the dose that you are
Mhm.
on. It is harder to
Yep.
wean off the higher the dose that you're on. You're going to have to play this game and see if you can figure out. So now Traxone is a drug that's FDA approved for, I know it sounds weird, but bear with me. It's FDA approved for recovering alcohol addicts and drug addicts, but there's this whole other usage of it that's off label. And they call it low dose naltrexone because we're talking about 10 times roughly much lower than the FDA approved doses, right? So significantly lower dose. And what we know about utilizing that much lower dose is it causes two main things to happen: extremely powerful anti-inflammatory effect, and it also modulates the immune system, specifically calms down that immune system. And that's exactly what you want when you have an autoimmune disease. And because at the base of every autoimmune disease is an overactive immune system that's targeting tissues for destruction, flagging it with antibodies, and creating all sorts of inflammatory distress. LDN's a phenomenal, powerful anti-aging product that's very popular in the anti-aging space. Just like anything, right? It's underground. It's not streamlined. It's not allopathic. Western medicine doesn't really recognize it like most of the stuff that we do. Okay, cool.
Before I started with you guys and before I started the tirzepatide, which I've been on about 6 weeks now, I did go through a naturopathic doctor and she did a bunch of tests. And one thing that was way off on me was my cortisol. It was
Okay.
high when it was supposed to be low and it was supposed to be high.
Okay.
And so I'm not sure what to do about that.
Okay. Yes, let's talk about that. Yeah. So cortisol, now where do I even begin? So we all know what cortisol is. It's a stress hormone and it gets demonized a lot, right? But in all reality, cortisol is extremely important and you need it when you need it and you don't want it when you don't want it and when you don't need it, right? So in the morning, every 24-hour period, we're supposed to wake up with a high pulse. And then as the day progresses, cortisol decreases and then it repeats every 24-hour cycle. It's a very expensive test, as you probably relatively expensive. Did you do saliva or urine?
Let's see. I'm trying to remember. I did a whole bunch of tests. One was the hair test. I did a hair test. I did the Dutch test.
The Dutch test. So that's urine.
Yeah.
So
Okay.
it's you have to check cortisol 4 points throughout the day. And
Uh-huh.
so either urine or saliva. And
Yeah,
they're both efficacious for sure. But so essentially when you're having cortisol in times when you shouldn't, that's that stressful situation. You're causing some sort of stress reaction or something's causing it. It's one or the other. You're causing it or something's causing it. We don't know. And so those tests are nice because they're supposed to help you identify, okay, I keep having this high pulse of cortisol at 4 p.m. or at least the day I took the test. So am I doing something very stressful at 4 p.m. of my life? Like that's one path that the practitioner is supposed to help you identify. But obviously, so I don't have enough, data, and that's not what this program can do for you. But I can give you general recommendations. So one of the most powerful things you can do with a dysregulated cortisol rhythm is take those adaptogenic herbs. And those adaptogenic herbs are in my stress. That's what my stress supplements are. So on the welcome, yeah. So definitely get that. It's called that is such a powerful supplement. Adaptocrin is Apex Energetics is probably one of the best supplement companies, and it's like the pricier one, but that's what most healthcare practitioners that are functional end up utilizing when they're trying to fix people. So adaptogenic herbs, it's a very potent dose of holy basil, panax ginseng, ashwagandha, and I think there's one more. So I would start off with, so you take it in the morning, start off with 1 pill, assess your tolerance. A couple days later, do 2, and then a couple days later, work up to 3. And as long as you feel good, ride that for another month or 2, and then let us know how you do, because I've seen some miraculous things happen just from adding that one supplement, especially to someone like you, who we know now it's a dysregulated cortisol pattern. The second solution is trying to find out why you have a dysregulated that's the ultimate solution. And are you not working with that functional practitioner or that naturopath anymore?
No, I only did a 3 month detox program with her because I was trying to get over all the COVID remaining tiredness and everything that I had from the couple years before. And that's why I started going there, because all I wanted to do is sleep.
Totally.
And so she got me on the eating cracked and a bunch of different things, but I could only afford 3 months.
No,
So,
functional is expensive, guys. And
yeah.
that's, my goal for you guys, and like many of you guys know, the long-term maintenance group that I want to create here for you guys is helping you guys as much as I possibly can with everything that I know and save you guys from not having to go there as much as I can. Definitely look at your daily schedule and see if you can figure out. So what I know from what you're telling me is that means you're low in the morning and you're high in the afternoon, somewhere in the afternoon, and it's
Mhm.
supposed to be the opposite. So outside of the morning, right, mid, late morning, rest of the day, identify your day-to-day schedule and see if you can identify something, right, that you might be doing that's creating more stress for you. So that's one thing to do. For the morning, there is something powerful that you can do to help increase cortisol in the morning. I believe I have videos on the optimal morning routine. If you can't find them, you can text us on the FLOA hotline. Or I can do if I have time today, I can get into that depending on what you guys want me to talk about. But one of the morning routine strategies that's really starting to grow in this space is getting sunlight in the morning. Getting
Oh,
sunlight and actually looking towards the sun, not at the sun, but look towards the sun for 10 minutes in the morning. And I would double dip and do something while you're doing that, right? Some sort of physical activity, something, so you're double dipping, so you're not just standing there. Although if you want to relax and do that too, you can. But that is one of the most powerful natural things you can do to really pulse out that cortisol in the morning, is getting those photons into your eye. It's got to be direct. It can't be through a window, can't be through a windshield. 10 minutes outside, up to 30 if it's an overcast day. So I would
yeah.
definitely try that as well. And then additionally, some sort of intense exercise, get your heart rate up in the morning too as well, would be another way to really pulse that cortisol in the morning. I would focus on those two things and then let us know how you do.
And the stress herbs that you said to order, are those okay on an empty stomach if you start out with one and then you,
Yeah.
like you said, gradually it's okay on a empty stomach? Okay.
Yeah, same thing like all supplements on an empty stomach. If you have nausea, you need to add something like soaked chia
Mhm.
seeds, for example, and work up
Mhm.
the tolerance to it. And
Yeah.
so here I am telling you to get back to that. I'm going to be putting out this sleep video. It's an updated one. We have sleep videos on Flow University, but this is going to be an hour long, really powerful sleep video. Strengthening your sleep will enhance the cortisol in the morning. So I'm giving you like the hierarchy so you're not feeling overwhelmed. Take the herbs, get the sunlight, identify the stress patterns in the afternoon, exercise in the morning if you can, and then improving your sleep quality. Those are like the things that you can start focusing on now.